David, thanks for joining me today. We're going to talk about a conversation that's difficult to have, and that's around non-therapeutic circumcision and the mental health impact that that's had on people. And we're starting a conversation really, hopefully to help other people have that same conversation.
Yes, I hope so too. It's not even, as well, you were saying non-therapeutic, it also applies to so-called therapeutic circumcision.
Yes.
Which is often done without any thought.
Yeah.
So yes, I'm looking forward to this conversation
in
one way and dreading it in another.
Yeah.
Because going public in some ways is not easy.
No.
But,
So David, I feel this conversation, it's probably worth mentioning before we get into it, I feel that this sits on the edge of something quite uncomfortable. Not because the experience is rare, but because acknowledgement itself carries consequences. Naming harm isn't a neutral act, because what we're going to be doing is destabilising long-held beliefs, relationships and assumptions. I'm interested in how you hold that, both personally and professionally, especially within the work that you do within 15 Square. And one of the ideas that I keep coming back to is that disenfranchised grief doesn't just happen by accident. It's maintained across generations, religious institutions. And if this grief were fully acknowledged, a lot of people would be forced to look at the decisions that they made, and quite often decisions that were made out of love, not harm. So I think the opening question I've got for you is, why do you think this particular grief struggles to find recognition?
Well, you are right in what you say, that it is uncomfortable.
Yeah.
And I mean, I've been doing this for 30 years, and sometimes even I find it uncomfortable when I should be. I mean, I've spoken publicly, but it's a very personal thing. You're talking about a part of the body that nice people don't talk about, basically. And I think you are right that when you say that it struggles, because there are so many people who are wary of it. First of all, it's an item, it's an area that you've never been able to discuss.
Yeah.
A, because it's below the belt, and nice people don't talk about things below the belt. But also it crosses a lot of barriers.
Yeah.
You know, you have the medical side, and also you have the religious side, and people are worried about criticising it because they're worried, A, they might affect people who've had this done for a religious reason, or also culturally. I mean, you have to remember that, especially in the United States, it's a cultural practice.
Yeah.
Really, unless people talk about it, unless people actually are willing to speak openly, then things are never going to change. So I think for me, you sort of, I know when I've spoken about it in the past and it's gone public, I've hidden away for about 2 weeks. But I think that the more you speak out and the more people are encouraged to speak out.
Yeah.
But also when you do speak out, you suddenly find a lot of support. Support from family or from relatives or from friends. And, you sometimes think to yourself, I wish I'd done that earlier.
Yeah.
But also not speaking out, you still got that burden inside you that's dying to get out, and you don't know. It doesn't go away. And by not facing it, and I've seen so many people who, they try to blot it out, and sometimes they will resort to alcohol, but it's not solving the problem. You're putting a sticking plaster on it. You're not actually treating the wound.
Yeah.
Yes, and the other thing as well. I mean, speaking out, you're making a lot of people uncomfortable, apart from yourself, and it's amazing how sometimes people react to you. I can always tell when somebody asks me what I do, You know, you can get people who will say, oh, it's never happened to me and I'm glad it hasn't. And then you get some people who will say, well, it's happened to me and I wish it hasn't, but I'm a bit wary. And then you get some who are very defensive.
Yeah.
And I think that the ones who are the defensive are the ones who really need to recognise that they've been harmed, but they can't. They actually can't face it.
Yeah.
And that is the worst type.
And I think one of the points that you made there is this decision to have this done. It's not an abstract one. It's often made by parents.
Yes.
As I said earlier, out of love, not harm. So challenging that viewpoint, actually talking out and questioning, that's going to have a negative impact. And I wonder whether it's easier for people to stick with that same narrative, that this is something that is in some way better, whether it brings you closer with society, the society that you grew up in, the community, and whether that's easier than actually denying that this could be harmful in any way, shape or form.
I couldn't accept that.
Yeah.
I mean, to me, it was strange, really, because I just didn't know any better. I'd never ever seen another person to compare with, really.
Yeah.
I mean, I didn't know, and it was only when I was about 12 or 13 when you started school sports and you suddenly noticed that you were a bit different in the locker room.
Yeah.
And I just, and it was only the first time I'd seen a normal male, and I at that time I didn't realise what had happened to me. I just thought I'd been born that way.
Yeah.
And it was when somebody actually told me, it was then that it hit me like a ton of bricks, really, because I knew there was something wrong. I knew, you know, from the way people were talking, you knew that you're not, there's something different to you.
Yeah.
But then you face a problem with, nobody's told me about this. How do I find out what's happened? In my case, I went to the doctor because I thought, well, it'll be my medical records. You know, I've obviously had an operation. Nobody's ever talked about it. Nobody's discussed it with me. Nobody's told me. And yet every other thing that's happened in my life was open. And I remember saying to this doctor, you know, can you give me some information? Now, I have to say that it was a different doctor, it was a different surgery from where I was young. And he said, there's absolutely nothing in your medical records. And I said, well, I can't understand this because obviously I've had an operation.
Yeah.
And the only thing I knew was more or less where the hospital was. I mean, that was something that I found out a bit later. But I said, well, I've had a surgical operation. Surely anything that involves a hospital stay should be recorded. And he said, well, not really, because people, you know, it's so insignificant that nobody would even think of recording. The doctor would probably think it wasn't even enough to record.
Yeah.
And I said, well, I'm sorry, but I disagree. It should be recorded. And he said, well, you know, nobody's ever complained. And I said, well, you can't say that to the next person, but I bet you do. And he says, well, you know, you should be thankful. You know, this is a lot better, etc., etc. And I said, I'm sorry, but if you don't understand this, I don't want you as my doctor.
Yeah.
And the look on his face was absolutely amazing. And I just thought to myself, I'm not having this. You know, you are treating me as though I'm sort of wrong by querying something. You know, if I'd had a finger amputated, you know, it would have been important enough to record. Why was this so different? And he got quite hostile with me. And I noticed that sometimes when you raise this, people feel threatened, especially the medical profession. You are challenging them. And I don't think anger is any way of tackling the issue. You've just got to stick to your guns, and actually make them look fools. Because I thought to myself, well, and it's fairly obvious that some of them they're actually, I don't know, but I suspect that this doctor was also one who'd never thought of what had happened to him. It was patently obvious, the way he was defending it.
Yeah.
And yet, strangely enough, a while later, I knew a doctor in the same practice who'd there was a friend who'd got a son, and she'd taken him to the doctor, but then the doctor said, "Oh no, you mustn't have him circumcised." So it was exactly the same, the same practice, but two different attitudes.
Yeah.
And I think this is what we're up against. We've got to train the medical profession that this is wrong, but in doing so, we're opening the floodgates, because they are frightened. If I acknowledge this, I'm going to be facing a lot of lawsuits.
Yeah.
Then there's the religious side, and I've now got many friends who are Jewish and Muslim, and some of them have spoken out, and it's difficult for them to raise it, because they're not going against their culture; they're going against their family and religion. Yeah, that is very difficult. But you have to speak out. Yeah, and in speaking out, you have to face the. I know I said to some of my family, I know I'm sorry that you might see me in the press. I hope this won't embarrass you. And I've had some lovely responses. No, we're proud of you for what you do. So that's all I need to know, really. Yeah, and I think as we're talking here, this conversation is highlighting, David, that you're involved with this, not just on a professional level, but on a very personal level as well. Yes. So you've talked about how difficult it is to start a conversation with a family member. I wonder if it's okay to do so, whether you could talk about perhaps a conversation that you've had and how you went about bringing that up with family. Yes, it was obvious when I was in my early 20s. I had a total breakdown, basically, and they were trying to find out what had caused it, because I collapsed, basically. The stress had got to me. And I had all sorts of tests that they ruled out epilepsy and everything, and they said that there must have been some sort of trauma that had triggered this. And but it was whenever I went to anybody, they always tried to find out what was the real reason, and I was telling them, so that made it worse. I'm sorry, what you just asked me? So you've talked about how difficult this is to speak with family, to broach this subject. I just wondered if you got personal experience of doing that and how you went about it. Yes, I actually went, and I went, and they said, examine me, and they said that there was something had not gone right, actually. But they asked me what had happened. And because there was no medical records, I didn't know. So the next port of call, I had to ask my family what had happened. And I didn't go down the circumcision question route. I remember talking to my parents, and I said, what was wrong with my foreskin that it had to be amputated? Yeah. And the look was, I can remember it to this day. I mean, both my parents are deceased now, but my mother said, I can't remember. Yeah. And my father just laughed, walked out of the room, and said it was nothing to do with me. And that was the last conversation I ever had. The result of that was that we never had any conversations about anything after that. It was just, but the family members who I have spoken to since, because obviously I'm now in the public realm, and I've had some very, very interesting conversations, some relatives. Yeah. And I have had no animosity at all. As a matter of fact, I've had some tremendous support. And I've actually found out more than I would have done normally through actually speaking. So, this is opened up conversations. I mean, I know that it's opened up conversations with family who said, well, I've never spoken to my sons about this, but I will, So even in my own family, it's opened the dialogue.
Yeah.
So
But you highlight there that there was a negative consequence of speaking out, where you that changed the dynamics within your family, where you felt that you couldn't have a deep conversation about anything from that point onwards.
Yeah, I know my mother had a cousin who was, she was always on about it, and she was always talking about it. And, I mean, it was obvious that she'd had 2 boys, and it was obvious, and she was very proud of what she'd done.
Yeah.
And I think that was so I think that was probably the catalyst. I mean, my mother knew nothing about.
Yeah.
She was ignorant. She came from a thing where you didn't talk about things. She wouldn't have even known what it was. So I mean, I don't know, but I would suspect that she was probably the doctor, or I just don't know. But I suspect I didn't have a medical problem.
Yeah.
But I will never know that.
Yeah.
That is a point I've made several times, because it's if you don't know what's happened, you can't really grieve.
You don't know what
you don't know what I'm grieving for, and if you've had a medical issue and there's something that's had to be done, that's one thing. But if you have something done to you and there's no medical issue, that's another thing.
Yeah.
And so if you don't know what you're grieving for, it's difficult to even move on. I mean, it's something you never move on from anyway, but you can live with it, basically.
Yeah.
And I've always said that people have to find their own ways.
Yeah.
But yeah, it's funny, and I mean, I never will know, because there's nobody alive to tell me.
Yeah. You say that people have to find their own ways. So what ways have you found?
Tackling it head on.
Yeah.
It got me into this job, basically. And this is something I've got to do until I fall off my perch. I can't stop doing this.
Yeah.
Because it is my therapy.
Yeah.
And I always say to people, when they've got this sort of trauma, they need to find their own coping mechanism. And this is mine.
So that being said, how is it for you maintaining this personal lived experience and also being the director of what is now an international charity?
Yeah.
Dealing with the same subject?
It's strange, really, because I have inquiries from people from all sorts of walks of life, and I have people who've had this happen to them and people who don't want it to happen to them. So I have to listen to them and answer their questions, and my personal situation is irrelevant. It's irrelevant to them, really. Sometimes I am asked, and then I will volunteer. But I think to be professional, you've got to give people, the advice that they need, not necessarily based on your situation.
Yeah.
And I've never really felt it uncomfortable. And I've had some, I mean, I've had an inquiry this week, and the inquiries just astound me. People from all walks of life with different sort of situations on this. Only this last week, I've spent, and you never know what's going to happen. You can pretend you can start to do something during the day, and then a phone will go, and that messes up the whole of your day. And I had a phone call this week, and I'm not going to betray any confidences, but it was somebody who was aware that somebody that they were close to, a family member they were close to, was intending to have their son circumcised, and he was desperate to stop it. and I was putting all sorts of information together.
Yeah.
And it's, you know, and then you have to support that person afterwards if the family member's gone through with it.
Yeah.
Because they are then going to feel, what am I going to do going forward? You know, it's...
And how's that for you, managing that sort of situation?
I suppose I'm used to it. And I think I'd rather try and manage that situation than let somebody go ahead and, you know, not give them the information.
Yeah.
It's I feel quite proud when I see somebody, you know, that I've given information to 20 years ago, and I see the son who and I think, you will never know how close you came.
Yeah.
And so, you know, it gives me a lot of satisfaction.
Yeah. I think one of the questions I get asked a lot is, working in the area that I work in private practice as well, is what I do to kind of switch off. Well, I've got the luxury of leaving whatever space I'm in and closing the door on it, because quite obviously I'm a female. This isn't something I've experienced personally, only vicariously. So for you, how do you manage?
I'm hyperactive.
Yeah.
Yeah, I'm hyperactive. I'm always doing something, probably gardening. You know, if I go, if I've had a sort of bad day, I will go into the garden. My only problem is sometimes, and if I've got something coming up that I know I've got to face and I don't quite know how to do it, then the whole of the rest of the thing, I will start something and I don't know what to do next. That's the only thing that I find is a bit, you know, sort of.
Yeah, maybe.
I'm okay when I know the answer, when I know what I've got to do.
Yeah.
It's when I've got a situation and I don't know which way I've got to jump, and jumping one way or another might cause a bit of an issue.
Yeah.
But yeah, I think the other thing that's been really interesting is meeting so many professionals in this, and the legal side, and also from the religious side as well. And I think in the very early days, and I will always be thankful to Victor Schoenfeld. Victor was is a filmmaker, and when we were first formed, he was he wanted to film a documentary. And Victor is Jewish, and he was aware that this caused a lot of problems within the Jewish community, but wanted to highlight it. And he asked if I was new on the block, you know, I'd only been involved for a few months. And I spent a day with him at his flat, and I was actually interviewed. He didn't use my interview because, and I will say it took him 10 years to get financed to make this film. Yeah. And he wanted to film a procedure, a Jewish bris being carried out. And I'll never forget the researcher coming into his flat, and he said, Mrs. Hawksworth's had a boy, the filming's on. And Victor saw my face. He says, this is going to happen to this boy, and if doing that will help others. And I just said, well, it's no consolation to me, but what I didn't know was what was in store for the boy. Yeah. Because the film, and it's still available, it's now available freely. Yeah. The next thing you saw was the father sitting outside the intensive care unit, tears streaming down his face, saying, I don't know what's happening. And it was the most, it was very touching. Victor's become a very close friend, and I'm still in touch with him all these years later. But it took a toll on him, and I saw, you know, I think that was very important to Victor. Yeah. You know, that was his way of giving of opening the dialogue.
His way of
he's
finding an outlet.
He's been very active in the European courts. He's given evidence, but I will always remember that. And I got to know a lot of members in the Jewish community, Dr. Jenny Goodman, who was promoting Brit Shalom. You know, it made me realise that the awkward situation that people face when they are forced to make these decisions that they really don't want to, when there's no support. Yeah, and I've recently watched Victor's video, and out of a lot of the trauma and horrors that I've experienced personally and vicariously, that was truly horrific. And maybe we'll get a link posted to that video should people wish to watch. Yes. But it is truly horrific. It's interesting that we were fairly new on the block. I mean, we started this charity. I hadn't even got a computer. It was in the early days, and all I got was a word processor. But I just said, you know, you can make an organisation look very professional by having a letterhead and a patron, or you know, you can. This. We got a telephone number. Don't even, had we? We'd only just probably got one. I don't think we had. But I said, you know, could this, it was filmed on Channel 4, and I think it was one of the, first programmes to be actually broadcast without a commercial break. And I just said, could we get a link to it? And they said, yes, okay. And then there was a thing, well, where did we direct people to? So I remember I said to our committee, well, we got no office. I didn't really, nobody wanted it coming to their home. So I said, why don't we open a post office box? So that's what we did. And the post office box arrived the morning of the thing was being filmed. It was broadcast, and we were absolutely inundated with letters afterwards. And that's what really started the thing. I mean, several people had tried to get injunctions to stop it being broadcast. But it was, there's been several films since, but I think that was the most memorable, and I'll always be grateful to Victor for actually starting this. It was... for actually putting that out there and acknowledging it on a completely different level. And I think going back to what we were talking to earlier, with people having these difficult conversations with family members, I guess now what I'm doing is speaking to partners, parents, family members. If somebody should raise this as an issue, I wonder what you feel responsible acknowledgement would look like. Yes, I think it's very difficult for a partner. First of all, they've got to notice that there's something wrong. But then, very often, the person who's got the thing finds it very difficult to open up to a partner or somebody, because it's too close. And you know what I mean? It's all very well sharing it with somebody who you don't know all that well, but sharing it with a partner is very, very difficult. It's and I think you know, I know that there's been talk about starting a support thing, and we've had quite a few within the organisation who want to. I know we've got a lovely couple. They're quite open about it. There's a man and wife and two sons, and they have been really very good. I mean, the lady, if I've got somebody who's really in distress and wants to know a partner or a supporter, then she speaks to them, and that's been very good. But I think that there needs to be resources for this, because I think that this is something, and I mean, I've been guilty of not knowing this, because I find it a bit difficult to speak to, you know, family members on a personal level. I mean, they know there's something wrong, but so maybe if I ask if
you had that conversation with your parents, how you would have wanted them to respond to you? How should they have responded?
I think my parents took it as a threat.
Yeah.
It wasn't. All I needed was the information on what had happened so that I could come to terms with it. I wasn't blaming them.
Yeah.
I mean, they were following probably the medical advice of the day or social advice of the day. I mean, a lot of this has to do with private medicine. And I think, you know, people with private medicine will always have more treatment than is probably necessary. So I wasn't trying to be confrontational. I was just wanting to know the details.
So advice to parents out there then that perhaps are waking up and having this conversation with their sons.
Wake up and smell the coffee.
Yeah. Engage in a conversation.
Be empathetic. Yeah.
Answer questions that are being asked. Let them know why it was done.
That has happened with members of my family. I've had or friends. I've had them when they know that, you know, they've not been aware of anything. But how do I approach it in case there is something?
Yeah.
So it's interesting. But
and what advice have you given them?
I've just said be open.
Yeah.
You know, and sometimes though the thing is when you're going into this sort of conversation, and I noticed this in earlier times when people want to open a conversation and they suddenly start and the person doesn't know how to respond to them, so they back away.
Yeah.
And that person thinks of it as rejection. It isn't. They need thinking time. And what I've said to many a person, open the conversation by asking the question. Judge how that question has been received. If there's a reception, just let that person talk.
Yeah.
But if there's a sort of, you know, just leave it. And then, you know, maybe wait 2 or 3 weeks and sort of ask again, oh, have you thought about this? And it's amazing how that works.
Yeah.
But I've seen 1 or 2 go in like a bull at a china shop, and it's had the opposite effect, basically. It's closed the conversation down.
Yeah, and contrary to popular belief, sometimes it's best to go to bed on an argument.
Yeah,
that
not even an argument.
Reset.
It's
a difference of an opinion, perhaps.
Yes, it's it is difficult, very difficult. Yeah.
I'm aware that this conversation may open up conversations in different houses. I wonder what you would hope that listeners take away, having heard us speak today.
I just hope that people will treat the situation. They may have a lot of guilt. I just hope that they find out the knowledge. I hope that people study what this actually does to people. You know, it's not just a harmless thing, as we now know.
No.
I mean, the other thing that is different, that it's worth saying here, the people that I've dealt with over the years fall into 2 categories. Those that have had it done in infancy, before puberty, they don't know what they're missing, basically. Yeah. They are more worried about the look of it. And they know that when they're older, they know they're not functioning, sort of as a normal man would. But they don't know why or what. You know, they're more worried about so that's very different. When somebody's had it done post-puberty, perhaps a phimosis, then they go to the doctor and the doctor say, oh, circumcision, and well, no, 6 weeks you'll be fine and it'll heal. And I say that's like going from having full sight to being colourblind. And that can be the biggest trauma. I've had an inquiry only this morning from somebody who was in his 20s, and that trauma has never ever left. He wasn't told. And I talk about Alex Hardy, who his mother is our patron, and Alex was 21, went to the doctor, got phimosis, and the doctor said, oh, a circumcision, and he lived for 2 years with the consequences and then took his own life.
Yeah.
That was a needless death if he'd been given the right treatment. And I mean, the awful thing about it as well, nobody speaks out when they've got the problem.
Yeah.
You know, and quite often if they speak out about it, that might also help. But you feel so alone.
Yeah.
You know, if you feel like that, and I mean, I've personally dealt with eight people who've been service users of this charity who've taken their own lives.
Yeah.
So it's not, you know, people, as I say, need to speak out. People need to watch as well. Watch reactions. Watch people may sort of go down or.
Yeah. And Alex's mom wrote a book about his experience. It's called A for Alex. A for Alex.
Yeah.
Yeah.
Yeah, Leslie Roberts.
Yeah.
Leslie's been absolutely wonderful, but actually Alex's brother, his younger brother, he filmed something. Did he film it? Yes, he did. So I'm not betraying any confidences.
Yeah.
And he said that he wishes Alex had spoken to him.
Yeah.
Because he had the same problem. And he solved it by stretching techniques. He says if only the brothers had talked.
Yeah.
You know, and Alex's brother is now feeling guilty that he didn't notice or wasn't able, and yet he wasn't, you know, nobody knew.
And on the 15 Square website, I know there's lots of resources in relation to that.
Yes, yeah.
So, coming to the end of the conversation, with everything that you've just said, what do you hope that people will feel after listening? What do you hope that people will allow themselves to feel after listening to this?
More confident.
Yeah.
Less embarrassed. More empowered.
Yeah.
Don't hold back. You know, just you know, it's. I mean, people talk about all sorts of things. I mean, women talk about. You know, I mean, women will talk about their husband's bits where men won't. That's the other thing about men.
Yeah.
You know, you get a group of women, they talk about everything bodily, but men don't. Yeah. Because they think then, you know, they don't talk to each other about anything below the belt because it's the ultimate taboo in a way. Yeah. But we've got to break this taboo.
Absolutely.
There's more organisations. Actually, now we've become members of the Association for Men's Health and Wellbeing, and I did a podcast with them a few weeks ago, and that's a fabulous organisation that's taken this subject seriously. And I think the other thing that we've got to do is raise awareness in other spheres. And I know we have a lovely colleague called Michael, and he spoke at a conference on. It's a psychology conference.
It was the BPS, the British Psychological Society.
I couldn't remember what it was. I actually went to support him.
Yeah.
And the chair at the time, after Michael, I was wondering how it would go down, and he said, "We need more of these. We need more of these talks. It's very refreshing because it brings a new insight into that." He was really, and he opened up about a family issue in public in the middle of that. And I think we've got to get more people into other events. It's, what is it they say, if the mountain won't come to Muhammad, Muhammad must go to the mountain. Yeah. And I think speaking out, getting more people, I hope more people will be empowered to actually speak about that, you know, and go and give talks. I know a few years ago I was invited to give a talk to a Rotary Club in Stone, and I agreed to it, and I turned up at the thing, and now normally they got an audience of about 40 men at this Rotary Club. There were 6 in the room. That's said a lot to me. Yeah. Because the 6 were very supportive, but what happened to the others? Why wouldn't they face it? There was another one, Tom Rosenthal did a wonderful comedy routine, and I thought, I don't think, how can anybody make comedy routine? But he did a wonderful show that he took to the Edinburgh Fringe and then took it around the country. And I mean, I went to see him at the Edinburgh Fringe, and it was really well received. But interestingly, when he brought it round the country, I went to, he did one at our local theatre in Stafford, and he interacted with the audience. And one woman said, "Oh, my husband's circumcised, and there's no problem with that." And he said, "Well, is your husband here?" "No, he wouldn't come."
Yeah.
And there's a woman on the front row said, "Well, my husband," and her husband was sitting next to him, and you know, that's fine. And he looked at the husband and said, "Are you happy with it?" And the husband said, "No, not really." That was obviously married couples who'd not had a conversation.
Yeah.
The man was obviously, you know, but he'd never ever been able to talk to anybody. The first time was actually in an audience. I bet there was an interesting conversation in the car going home. Yeah. But you know, that was an example of why men do not talk, because they've not been encouraged to. So I do applaud Tom. I just hope he's going to do more. Yeah. It's you know, you can treat this by comedy sometimes, and sometimes it's necessary to have a laugh about it, because it also brings it out into the open. And I know, quite accidentally, I was at a conference in 1998. It was in Oxford, and it was being filmed live. And the interviewer said to one of our doctors, you know, "Is the foreskin, you know, valuable?" And without thinking, he said, "The foreskin's not something that can be amputated willy-nilly." And the poor guy couldn't hardly control himself, because it was a live interview. Yeah. But that soundbite, 6 months later, was released. There was a Radio 4 program called the News Quiz, and they did things that people have said. And Dennis Healey, who was then the ex-Chancellor of the Exchequer, actually mentioned that. So it got some more coverage. So sometimes, you know, an accidental thing, it can give you a laugh, but it does...
Humour can be a way of
communicating it. Tom taught me that.
And bringing something into the mainstream that otherwise wouldn't get an audience. Yeah. Yeah.
And I know I'll give you another example of why something accidental can ricochet round and cause this to go into the open. We were a member of a long time for Stafford District Voluntary Services, and I knew them well. We used to use their rooms, and they had a new receptionist, and she was tasked with ringing round all the charities in the borough to invite them to something. So she got on to me and she said, "It was that 15 Square?" And I said, "Yes." She said, "Are you Mr. Alcock?" And I said, "Well, no." I said, "But I'm David Smith, but the name is quite appropriate." So she said, "Well, why?" I said, "I'm not going to tell you, but ask the person who's sitting in the office with you, he was in a wheelchair actually, and he will tell you." So she put the phone down, asked him, she said, he laughed so much he was hyperventilating. And there were about 10 people in the office came in. So ever after that, when I went to a meeting and introduced myself, somebody said, "Oh, you're Mr. Alcock." And it opened a conversation. Yeah. And somebody said, "Well, why?" Yeah. So that person saying that and laughing asked people why. So that's another 10 people knew about the organisation from an accidental thing. So, you know, it does happen like that sometimes.
Yeah. And I think drawing this to a close, I think it's really important that people out there know that if they are experiencing feelings that they've got nowhere to go and talk, no one to share this with, a grief that's not validated, that there are people out there, and those numbers are growing. I think we feel that within the charity.
Definitely. Yeah. Definitely.
Yeah. Yeah. There are, you know, your grief is valid. You can come and communicate it with us. If not,
we hold Together Not Alone meetings online,
How often do they happen?
About every 6 weeks.
Yeah.
And we have people from all around the world.
Yeah.
Germany, America. I mean, we've got 2 wonderful American colleagues who, I don't know how we could work without them really. They're absolutely Dan and Leaf. They're absolutely brilliant. You know, they are, you know, they're very open with this. But it's getting people actually to take part in these meetings. And I sometimes say to people, join one. You can put an assumed name on the thing, and you can put your camera off, and you don't need to speak. You can just listen. And I remember we had one who did that, and by the end of the thing, he was the most voluble. He turned his camera on, and he's been a good. So that helped him.
I think you can't underestimate the power of peer support and being with peers who've experienced something that you've experienced too.
Yes.
And just validating each other. It's so important. So that's one thing that 15 Square offers. And also, we've just started a counselling support service as well, haven't we?
Yes. Yeah. Well, we're training counsellors going forward. I think that's quite important, because the more we can spread those. Yeah.
Because that's certainly one of the messages that I get sent a lot is people have experienced going to therapy and being invalidated. It's actually made things worse, because it's that whole, why are you really here?
Yes.
That can't be the problem. So we're taking steps to educate the psychotherapists of the future.
Yes.
Making them trauma aware.
Yes, very much so.
Disenfranchised grief aware.
I mean, sometimes we're actually giving therapy to the therapist.
Yes, certainly given that psychoeducation.
It's. I mean, this is the problem when people go for. They'll book for a counsellor and they're wary, and within that first minute, and just the immediate reaction is either open the door or close it. Yeah. And once that door's closed, it's closed to others.
Absolutely.
It's a very difficult thing. I mean, they need to be aware that. I mean, I know. Yes, I can. There's been some very funny episodes, really. You know, as I say, members of the medical profession, the way they're so dismissive. Yeah. And I find it. This is the one thing I found, that I found it very easy to treat them the same way if they're dismissive. And you know, it's like I said to you at the start. I said to that doctor, if you don't understand this, then I'm sorry, I don't like you. Yeah. And you know, you treat somebody else, but you're not treating me. Yeah. But I suppose that's my character. I don't necessarily, like to be patronised, really, which is what it is. Yeah. You know, take it seriously.
So, people that have taken time out to listen to us speak, I wonder what closing comments you've got for them.
Yes, I think you'll feel better. Once you open this door, to start with, you feel bad. Yeah. You know, you've opened the door. You've got to. What do I do next? You're in this decision of how do I. You know, you've opened Pandora's box. Yeah. Once Pandora's box is open, that's it. You've opened it anyway by having these things. So you need to do what you think. What is best for you. Don't go shouting. Talk. Gently. If you're addressing members of the family, you know, keep a low profile. Anger doesn't solve anything. Yeah. You know, be calm, and you know, be willing to criticise if necessary, but just be willing to open up. Yeah. And I think that is what I would say, because there are people who are there to listen to you. Yeah. Well, David, thank you for being so open about your own personal experiences. Yes, thank you, Leanne. I don't know what we'd do without you opening. I mean, you've opened up a new avenue for us. I mean, I know this was something you'd never come across before, wasn't it? And how have you found it? Therapeutic. I came
into this, I stumbled across you and Jason. I wouldn't say by accident. I think the stars aligned, and I got vicarious experience of somebody completing suicide.
Yes.
And citing this as the reason.
Yeah.
That I can remember back then thinking that this must have been a one-off botched operation. I had no idea that there was anything more to it. I was very much in the blissfully unaware category.
Yes.
And I think I'd parked that, and then I heard you speak.
Yes.
And all of a sudden that came back, and I realised then that I'd got to go.
But having parked it, you didn't dismiss it.
No.
You were open to.
Well, absolutely. And then when I heard you speak,
look where it's led.
Yeah.
Yeah. So that's what I'm saying. People need to be more open and be willing to listen.
Yeah.
Or be willing to talk.
Professionally curious.
Yeah.
Yeah. Thank you.
Thank you.